Good evening, everyone. I am Dr. Vaishnavi from the team of Voice of Healthcare on the occasion of World Mental Health Day 2025. We are proud to organize this panel discussion on Mind Matters in Crisis, ensuring mental health access in emergencies. This initiative by Voice of Healthcare aims to highlight the importance of mental health, particularly during times of crisis. India has experienced several emergencies in recent years, from natural disasters like flood and earthquakes to health crises like pandemics and even accidents or conflicts. These events impacts not only physical health and infrastructure but also mental well-being. People often experience anxiety, stress, depression, sleep problems, or even long-term conditions like PTSD. Families and communities are affected too, yet, mental health is often overlooked in the rush to provide immediate relief. Mental health is just as important as physical health, especially in emergencies. Timely access to mental health care can help individuals cope, recover, and rebuild their life. This year, the World Health Organization emphasizes the need to integrate mental health support into emergency response systems so that no one is left behind, regardless of where they live or their circumstances. To explore this topic, we are joined by an exceptional panel of experts who bring experience in psychiatry, psychotherapy, research, and mental health advocacy. They will share insight on the challenges, practical solutions, and the ways to build strong mental health support system in the time of crisis. So allow me take some time to introduce our panel members. Dr. Nand Kumar, professor in the Department of Psychiatry and in charge of the Center of Advanced Research and Excellence in Neuromodulation in Mental Health at AIIMS, New Delhi. Welcome to the session, sir.
Hi, good afternoon, everyone.
Afternoon.
I I may not be audible clearly because no, I'm in aircraft. I'm so sorry,
Yes,
but I will
not a
try my
problem.
best to participate.
Works, sir. You're audible to us, however. Then we have Dr. Vipul Rastogi, Clinical Regional Head at Sukoon Health, Delhi NCR. Welcome to the session, Dr. Vipul.
Thank you very much, Dr. Vaishnavi, for having me. I'm hoping for engaging discussion today. Thank you.
Thank you so much for joining. Dr. Dipti S. Shah, Psychiatrist and member of Indian Psychiatric Society and Indian Association of Private Psychiatry, Mumbai. Thank you for joining us.
Thank you, Vaishnavi. I'm really glad that we are having this discussion on this very important day of World Mental Health Day. And I think we will send our message across of how mental health is so important as physical health.
Thank you so much. Dr. Avinash D'Souza, founder, consultant psychiatrist, and psychotherapist, D'Souza Foundation, Mumbai. Thank you for joining, sir.
Thank you so much. I'm so happy to be here.
Thank you so much. Ms. Varsha P. Mathur, psychotherapist at The Metal Clinic, Gurgaon, online private practitioner and freelance trainer. Thank you so much for joining, Ms. Varsha.
Thank you, Dr. Vaishnavi. Lovely to be here.
So let's begin our discussion and hear from our experts about the importance of mental health in emergency and how we can ensure timely access to care for everyone. So my first question is to you, Dr. Nand. How do events like pandemics, natural disasters, or conflict affect people's brain and mental health in the short term and over long term? If you can hear us, sir. I believe he might join us after a while. So we'll take a question to you, Dr. Vipul Rastogi, that what psychological reaction do people most often show during crisis and how can healthcare system better address these needs proactively?
Yeah, so what we would say is that everybody is very, very different, and their responses are, equally different. Essentially, when people are hit by pandemics or things which are very unexpected, there's a sense of loss of control. Now, when you have this sense of loss of control, either people can become very panicky, agitated, restless, and with all the physical symptoms of anxiety, but also people can become very numb, demotivated, and what we call as learned hopelessness, right, or helplessness, where nothing's going to change. We'll take it as it comes. So both of them, or either of them, can be seen in people. Again, as I said, people, everybody is very different, and the responses will be very, very different. Now, these are the expectation in the short term, but in the long term, there is definitely a depressive sort of phase starts in people. Now, whenever something like this is happening, we want to intervene as fast as possible. So, giving people some support as fast as you can. Now, there is an acronym that is used, which is called QPR. So, the basic psychological first aid that is given. So, Q stands for question, right? So, you question the person who's going through a difficult time. P is to persuade them to seek help, and once they say yes to it, you refer them to a psychiatric or a psychological professional to help and support them. So again, first thing is to be available to people, right? Somebody who's there. Of course, when things are going really, really badly, a pandemic or a crisis that has happened, people are very much towards a physical safety. But once physical safety is established, then psychological safety and well-being must be given priority, so that there is no long-term consequences of the difficulties that they've experienced.
So thank you for explaining it so well and helping us understand that acronym. It really helps. So my next question is to you, Dr. Dipti, that how do crises disproportionately affect access to mental health care among vulnerable population, especially in urban versus rural context?
Yeah, thank you, Dr. Vaishnavi. I think we are all aware that services availability in the rural areas is not as good as it is in the urban areas. In fact, across the country, the number of psychiatrists, number of mental health professionals is much less as compared to what is recommended by the WHO. So we are a much smaller specialty as compared to other physical health specialties. And the urban-rural divide is very, very obviously felt. Almost one-fifth of the mental health professionals are only available in the vast rural areas, whereas most of it is centered towards the urban areas. What also happens is that the accessibility, most of the times the population of the rural areas has to travel to go to the cities to, engage with a mental health professional or to get their services. Also, we understand that the traditional mindset, which is seen more often in the rural areas, of, maybe something like a black magic happening, going to faith healers. So those points related to stigma. So all of these, any which ways, even without a crisis, causes a problem for the rural population to access mental health services. And when we are aware of this kind of a situation, we know that when there is a crisis, definitely the rural population is going to find it very, very difficult to get access to mental health care. I think there are a lot of issues that need to be addressed at the rural health level, especially substance use disorders, farmer suicides. We hear of it so often, but accessibility to mental health being so poor, I think it's extremely important that we try and work out ways and methods where we can get through to the rural population as well, go to the villages, like the west zone of the IPS, the Indian Psychiatric Society, has come up with an initiative which is known as Gaon Tithe Manas Upchar. So a mental health treatment should be available to every village, especially in Maharashtra, but of course we want to extend it to the entire country. So I think those are the kind of initiatives that we need in order to bridge this gap between the urban rural divide. That is what is going to be extremely important. But yes, in crisis, the rural population is going to probably not have any access to mental health services, which otherwise they would travel hundreds of kilometers and try and get. But in crisis situations, I think that's really, really difficult.
Correct. And I believe this year's WHO theme would highlight it, and we would have some actionable point after these discussions that happen on today, not just on our platform but other platforms as well. So, Dr. Avinash, my next question is to you: that how can early psychological intervention during crisis help prevent long-term mental health issue?
Well, I think the whole essence is that in crisis, whenever any mental health problems happen, if treated early, they can be sort of treated before they take deeper roots, which is, I think, very important. Secondly, what happens is that I think in not only crisis, generally also any mental health issue, if treated early, is always better rather than wait for it to escalate and sort of form more strongly and into the person. So, one of the things is always advised that mental health professionals have to reach the area where the crisis has happened rather than wait for people in the crisis to come. So, if there's a tsunami, we go there. If there's an earthquake, we go there. If there is uh, something that happens which is an unnatural calamity, we go there rather than wait for people to come. And everyone has their own way of dealing with a crisis. So, uh, their method of speaking, someone takes time, someone wants to talk more, someone wants to listen more, someone is slow in revealing. So there are multiple factors. So we have to go case by case. And though there's a general approach, but there's also individual variability that has to be considered.
Correct. I mean, in every at every places we are talking about how precision things can be come up. So I think mental health is also something wherein we'll have to address individual wise that how are they taking up things. So my next question is to you, Ms. Varsha, that what are the emotional and behavioral patterns you observe most frequently among individual facing crisis related stress, and how do you approach them in the therapy?
So, like Dr. Rastogi was mentioning, there's a spectrum of emotional and behavioral responses that we see in individual, and it completely varies from person to person what kind of they go through, and it's usually driven by their own inner narratives and their ability to cope with stress. And I would actually, I was contextualizing when Dr. Avinash was talking. I was contextualizing my experience of my experience of going through the 2001 Gujarat earthquake. So, incidentally, I was living in Ahmedabad those days. And I was a student. I was a student of psychology, in fact, at that time. And there were many relief camps. So when Dr. Avinash was saying to go there and to actually work there and be there with the people, I think as a student, that's what I started my kind of career almost to do. And I was volunteering at these relief camps, and a very common sense that was prevalent in the camps was the state of shock and trauma after the earthquake, and the people living there. There was the sense of helplessness of what's going to happen next with us. Do we, some people were experiencing a lot of grief. They had lost their loved one, or they had lost their home. And there was the sense of helplessness and hopelessness as well of where will we go once this camp is going to be here for some time, and where are we going to go, what's going to happen with us, how are we going to get back to our livelihood. So a very strong sense of fear as well, because the aftershocks kept coming in, and we didn't know what to do at that time. It was so suddenly this shock and this trauma and this earthquake happened, and the fear prevailed, and I could see the people were not able to sleep because of the fear of will we have to run out, what will we have to do, and also the fear of any movement that would happen, they would get startled and scared. That is there this is another aftershock. So there were a lot of these intense mixed bag of emotions that one could see at the camp and all over, of course, the city and the state. Additionally, one could also see a lot of physical symptoms that cropped up, which we actually call psychosomatic symptoms, like chronic headaches, or digestive issues, or stomach aches, muscle pains, joint pains, and along with that, also a lot of eating disorders. So there were people who would binge eat and stress eat, but there were also some who were completely socially withdrawn and didn't want to eat or talk to anybody around. Another common thing I saw there was a lot of people neglecting their own health, maintaining basic hygiene, taking care of themselves, or even having the ability to take care of their little ones, because this sense of shock and trauma just kind of overpowered everything else and was almost a state of numbness and didn't know what to do, where to go. And interesting, so this was at the time when, of course, the earthquake happened in January 2001. But when I became a professional and I started working, even in 2005, 6, 7, I was seeing cases of post traumatic stress disorder around the month of January. So from maybe October, November, we would see cases of those same symptoms recurring for people and the same stress and trauma kind of they're experiencing all over again. So it's not only the incident at that time when you experience this, any emotional or behavioral issues, but also it can be continuing for as many years. And it's important to address them and treat those symptoms. Now, to answer the latter part of your question about therapeutic modalities, I think what worked and what was very important to do was to validate the emotion that they were feeling. It was very essential to normalize the emotion and let them know that it's okay. They're not alone in this experience, and there are many others who are going through the similar state of, say, fear or shock or grief. What also was helpful was giving them strategies of just art or journaling and something they could do in their own space, or listening to some music, relaxation techniques to just calm them down, because they would be very anxious and agitated at that time, and almost believing that there was an earthquake happening then. So even breathing techniques, emotional regulation, say simple grounding, deep breathing techniques would help them just be present and know where they are and the earthquake's over and was long back done. This helped them just emotionally regulate themselves at the moment in the present. Then also a lot of cognitive restructuring, which is about kind of identifying and challenging your recurring unhealthy negative thought processes, and how to replace them and change them to more healthy patterns of thinking. And also, along with that, somatic techniques like tapping really help, where it also aids and it targets on the physical symptoms that they're experiencing and helps them release that, as well as regulates the nervous system. So the accumulated stress and the agitation, the anxiousness, the fears can be released through any of these techniques or all of them used at different points.
So you have very well explained that how does the signs and symptoms of this also vary from person to person. And in terms of the treatment part, we'll also explore a few more treatment options in the session going forward. So taking my next question to you, Dr. Vipul, that what are some of the practical steps that mental health institutions can take to expand access to therapy and counseling during emergencies, if we speak about? So you're on mute, you'll have to unmute.
Excuse me, apologies for that. I think when we start looking at barriers, I think, and we specifically are looking at Southeast Asia, India, the first thing is always that stigma that always stands out. Look, I don't have a problem. I'll get better by myself. I don't want to seek help, or seeking help is a sign of weakness. I can do it myself. So I think that is the first thing. So fighting the social stigma, I think, is of course the first thing. Second part is, how do you make therapy, help, support accessible? And when you talk about accessibility, you're looking at, of course, the distance, as people were talking about, how far the help is. And Dr. Avinash said that you have to go to the community to help, because you can't expect somebody who is in, let's say in the mountains, to come down and, seek help, therapy every week, or, even every month. I think it is impractical. I was reading some stats that in European countries, there's one psychiatrist per 25,000 people. In India, that average is one per almost 1.5 lakhs or 2 lakh people. And again, the spread is so bad, right? So urban people or urban communities have a lot of psychiatrists, but rural communities hardly have any. The second part of accessibility is, of course, the cost. Now, public services, of course, are very cheap, or they're almost free. The private setup or private psychiatric services are very, comparatively much more expensive. And there's a balance to be found, between private institutes or institutions, between community service and financial stability or viability of their project. So I think those both the things, accessibility and of course the stigma that we fight each and every day, both become very, very important. Community oriented, there is a very big part of your psychiatry which is whether we are culturally sensitive. So there are things being done differently, let's say in southern part of India or western part of India. You cannot go with the same mentality from the northern part of India. So having that sensitivity when you go to rural areas about what the community wants, what the community thinks, and we have to adapt, otherwise we'll be out of sync. And again, as I said, the stigma will be even more, not less. Offering flexibility, offering, with internet being more accessible, whether it's online or group sessions, can be very, very helpful. And I think that is something that should be considered. Again, as far as accessibility is concerned, do we go and make, as we do for corporates, do we make mental health champions, right? So we go and train workplaces. These are the signs of mental illness. These are the signs that you need to look out for. And of course, after that, you refer people out. Or you're teaching, or you're training the teachers to pick up, whether it's simple things like specific learning difficulty, or a case of abuse in the class. So those sorts of things. So as as private organizations, do we go and train more people who can go and help and do that, at least the initial evaluation, so that people are able to come forward and seek help.
Correct. So, yes, I believe that addressing these gaps is very important. So, taking this conversation forward, my next question is to you, Dr. Dipti, that how can professional bodies such as maybe Indian Psychiatrist Society contribute to bridging the amount or the treatment gap and ensuring community continuity of care in the time of crisis? So, how is that possible?
Right. Yeah. So I think Indian Psychiatric Society is one of the largest professional bodies in the world of psychiatrists. We have more than 8,000 members on board, and as a professional body, as a society, I think we can make a huge difference in providing services, especially in the time of crisis. We do have a disaster management task force which is now active in implementing and formulating a policy which can be used. We are going to present that to the National Disaster Management Body also. So there is a policy which is being made for disaster management. Along with that, we like even in the pandemic, so the IPS per se, we all members were collaborating with each other. There were helplines which we were part of, so whatever online support we were able to give during the pandemic when patients were unable to access mental health care, there was a lot of online support which was provided by the IPS members to a large number of patients. We tried to seek the help of even the pharmaceutical companies and provided the medication to people who could not go to the chemist or purchase medication because of the pandemic restrictions, lockdown, and those kinds of things. So I think as a body of professionals, there is a lot that we can do. So as I was mentioning earlier, the initiative Gaon Tethe Manas Upchar. So that kind of initiatives, as the psychiatric body of the country, I think those initiatives, when we do it at a national level, it will be wonderful, and I think we will be able to then reach every village and every home in the country. Apart from that, actually making those units of volunteers which can, as Avinash was saying, go and reach the place of crisis and provide direct services. So I think that is something which the IPS can really work, because all of us are integrated under one body, and we can make these units, and there can be direct help that can be provided. Creating advocacy, working against stigma, I think these are things which need to be done even when there is no crisis, so that we are kind of preparing ourselves, like preparedness for the disaster. When we create advocacy and when we take care of the stigma, I think people are more open to take help. So that is something which needs to continue 24/7, 365 days a week, I mean a year. And I think we as IPS are doing a lot of work in that area. There are a lot of task force, subspecialty sections like the school mental health, the women's mental health chapter. So we are doing a lot of advocacy already, trying to create awareness so that people are open to take help from mental health professionals in terms of in times of crisis. So I think yes, IPS can integrate between the government, the NGOs, the private institutions, private psychiatrists, as well as the government, colleges, medical colleges, and we can really bring about a very good network which can help. I think collaboration is the key, and IPS can be kind of the leader of that collaboration.
Correct. And I believe, yes, Dr. Avinash has very well quoted that we will have to go and reach out to these people because there is still a lot of stigma where it comes to mental health. People find it very normal that it might be a stressful day, and then it slowly converts into something which becomes very chronic. So my next question is to you, Dr. Avinash, that how can community-based mental health program and digital platforms help sustain access to psychological support when in-person care isn't possible?
Well, I think online care was something which was always there, but we began to look at it more in COVID, and
Correct.
we got more comfortable with it in COVID. It was always there even before COVID. Teleconsulting was also there, but we just got more comfortable with it because we had no choice. So we all adapted. And now we work both online and offline. And I think the online platform is definitely beautiful because rather than have no care, at least let us have online care. And while, yes, I have always been a firm proponent that there is no substitute for face to face consultation, but in psychiatry particularly. But I think definitely the online platform will help a lot of people who don't have access to care. And I believe mental health professionals need to use social media more. They need to educate the masses about mental health, about the myths and the facts related to mental health care. In fact, if, as Dipti said, we are 8,000 psychiatrists, we're probably 32,000 psychologists in the country. I always say so I mean, even if you put one post a day, you have around 40,000 posts on social media on mental health. If all of us put one post a day, so there is, and if we come together and use similar hashtags and similar ways by which the post gets attracted, it is something that will reach a lot of people. I think also another very important facet is that, uh, like if you look at other fields of medicine like cardiology or pulmonology or nephrology, uh, well, there is a lot of glamour and candor to it. I mean, I think we need to do the same for psychiatry and make people understand that psychiatrists are as human as any other doctor. And, we are also mothers and fathers and sisters and brothers and friends, and we're not someone different, and we're not here to judge people and label them or put them in boxes of diagnosis, but we're rather here to help people. And most importantly, you don't have to be mentally ill to go to a psychiatrist. You can go, generally, people go to a cardiologist for a health checkup. You can come in for a mental health checkup. There's no reason why you have to fall ill and then come to us. So people go for their physical health checkups once a year. Well, it's time that we start offering a mental health checkup once a year for people so that we detect early and treat early. Yeah, thank you.
Yes, definitely. And I believe there is still a lot that we have to do to bring these people to these platforms and allow them to at least speak that how do they feel. It is as simple. And I believe there are a lot of initiatives that are lately being taken. I see the toll-free numbers that are now being prompted while we watch a movie or something which somewhere or the other they addresses mental health. And now that has I mean, it is slowly building in that habit that, okay, we have to talk about what we feel. So I believe we are slowly moving towards it. So my next question is to you, Ms. Varsha, that what can be done to strengthen community level counseling and peer support network to ensure early intervention and emotional resilience during crisis?
Well, I think panel discussions like this are kind of the way forward, and that are creating awareness campaigns, like all my other colleagues also mentioned. Having trainings, having workshops, putting posts, of course, is definitely one community level way of creating awareness for mental well-being, and these needs to be done irrespective of a crisis, because the stigma that we have, that is generally attached to our profession, definitely we need to help overcome that stigma. Also, one thing that works very well at community level is group sessions and support groups. I think Dr. Rastogi also just mentioned about them. Especially during COVID, I found many support groups and many counseling group sessions that were going on, and worked very well, because it was a pandemic and a lot of people were experiencing very similar emotions. Grief, of course, being the most prominent one at that time. So there were many groups like that, and the beauty of group counseling sessions is that you get to see and meet other people, even though it was online, of course, and at that time we needed to be online, but you still get to see and hear stories of different people, what they have experienced. And the beauty is that they all, the structure of group counseling sessions is such that everybody there has experienced the same thing. So it is focused on a particular theme. So, like I was saying, grief being the main one in the pandemic. So there were groups that were focused on grief. So everybody present in that group had lost at least one loved one. And of course, it was facilitated by a professional, by a psychotherapist or a mental health practitioner. So the group is structured in that way, but it largely depends on sharings of the other members there. And the beauty of it is it makes you feel that there are other people who are experiencing that, and like you can connect, and you're not alone, and it's okay to also feel sad and not want to maybe some days do anything and just be a couch potato. And then to know that there are some others also who are feeling the same way, like I was initially mentioning, validating of the emotion. It group sessions really help in that, and you don't feel alone in your own struggles and the trauma that you are facing. So that's one very big advantage of group sessions. It helps give you a lot of emotional support there. Building resilience, I think, is something that is like the need of the hour. I would really say and it's a skill that really we need to start building it from childhood, because at every step one needs to have the ability to really cope up and bounce back from any kind of a difficult situation, not even just a trauma or a crisis that we're experiencing. And which is why I have actually authored books on emotional well-being and social emotional learning for school students. So these are books that they can, are implemented in schools, and they have themes like, being empathetic, building and maintaining relationships, overcoming obstacles, having a growth mindset, being able to identify your support systems, building relationships. So the idea is being aware of and learning from these skills so that we build not only resilient individuals, but also a resilient community. And since this is to be imparted to students and children, it's important to have elders in their lives to also be having conversations and probably trainings and awareness programs for, say, teachers and adults and parents, in the lives of the children, because we all, I think, need to have these SEL, social emotional learning skills within us, to be able to cope, to be able to lead a healthy life of well-being, and like I think Dr. Avinash was saying, that it's not about that you have to fall sick to come to a mental health practitioner. There's nothing of that sort. It's also about just being aware of the fact that maybe I'm feeling low, and I have been feeling low for some time, or I'm not able to overcome a particular struggle or stressor in my life, and I just want to explore why that's been happening. So till we don't integrate it in our daily life, it's not a one-off, lesson that we impart in school. It should not be a one-off lesson. It should not be a one-off workshop or a one-off talk about it. But a regularity has to be maintained for us to imbibe it and it become a part of us, to carry these values and skills within us, and to create a resilient community at large.
Correct. So, picking up from there, the word resilience. I think carpe diem is something that everybody has been speaking about these days, but resilience is also a mantra of life. Anybody and everybody to cope up for from any moment, whether that is a failure in school, whether that is a failure in office or at home. So we all have to be resilient enough so that we come out of that situation strong. So, taking our session forward, my next question is to you, Dr. Vipul, that how can public-private partnership enhance crisis mental health response capacity across India?
Yeah, I think it's a very important thing, and I think a little difficult to achieve as well. I mean, that's the reality of it. The public sector has a very very impressive reach, but it has its own limitations regarding, how trained the professionals are, how much flexibility they have in their ways of working. The private sector, of course, the reach is not that great. We talked about accessibility. The reach is not that great. The cost becomes a constraint. So, can the private setups of private institutions, help boost the public sector? I think that's how I see it. So whether it comes through funding of some private, some public ventures, that's number one. Second, training professionals, providing expertise, providing internship. So those are the things that private sectors can do to support, and being open to collaboration again as well. I mean, some people may see it as a competition. There's no competition. Everybody needs to work together to get the mental health of the country right. And I think a public private partnership is the way ahead, because as I said, private sector is never going to have that great reach, and public will always have limitations as to expertise and the money that they can provide. So somehow we have to find a way, and whether organizations like Indian Psychiatric Association, Private Psychiatric Association, or Indian Psychiatric Society take those things forward, speak to the stakeholders in the government, and form a plan together, a comprehensive plan together. And it has to not start working when there is crisis. It has to start working now, even before the crisis, that things are in place, so that if and when, God forbid, if it, I hope nothing happens, but if something happens, then people are geared up for it. So I teach my son geography, and and they were giving example of Japan, how earthquake prepared they are. Everybody knows where to go, what to do, where are the shelters. Even children know. Of course, the adults and everybody knows. And so something like that, where the preparedness, maybe not to that extent. It's a more evolved society, and that might be something that happens in 25 years of time. But we can start working towards such a thing in the near future. And I think, as you rightly said, a public-private partnership is the way forward.
Correct. I mean, I think this is one space where the public dynamic is opposite of the private dynamic. I mean, in other cases, the private practitioners and the private institutions are at a better capacity, but here the public sector is at a better capacity. So I believe we require public-private partnership in terms of all the treatment areas and all the therapy areas that today we have in India. So my next question is to you, Dr. Dipti, that what lessons can India learn from global mental health models in empowering rapid access and continuity of psychiatric care during emergencies or in general as well? Ma'am, you'll have to put yourself on unmute.
Yeah, sorry about that. So I think overall we do see that the developed countries have better access to mental health facilities and services. Most of the times it is covered under insurance, so in that ways there is better accessibility. There is better accessibility in terms of the awareness, even in terms of the disaster management plans. Their teams are much more mental health wise aware, and they know what kind of first aid that needs to be, the psychological first aid that needs to be provided. So I think that is something that India can take from those models. But I think it's extremely important for us to understand that India is a very, very different country from as compared to the developed countries that we are talking about. So we need to customize those models to suit our population. One, I think the number is nowhere close to any of the developed countries. The population that we have is huge. So any calamity or even a natural disaster that affects us, the number of people who are affected is in multiples as compared to what it would be in a developed country. So I think that is number one. Number two, as I think all of us have been saying, that we are culturally very different in different parts of the country. So language needs to be local, people who are going into the community. So all that, I think one of the ways where we can really use the model from there is to the way we train the people at the community level. So training is something that we can take from them. And I think very uniquely in India, especially in the rural areas, you do find that maybe the sarpanch, or there will be some elder who is looked up to, even to kind of manage even small life events. So how do we go ahead with this, or what do we do about this, whether it is health, whether it is finance. So I think those are the leaders of the community who should be picked up and should be trained. There is ASHA workers, there are medical social workers, Anganwadi workers. So all of these need to be trained in the same psychological first aid. So I think that we can pick up from the Western models, from the developed countries models, but we need to customize it and have a policy and a training module which can be accepted by our country in different parts of the country in different languages. So I think Telemanas is another online helpline which is available with their app, and I think it is available in 20 different languages. So I think that is something which is already in place, and I think it's I think almost 20 lakh people that they have served since they started 3-4 years back. So I think that is something that is doing good job, and I think something like that which we need to probably replicate for the crisis situations as well. Rather than look at Western models, we should look at more what is more Indian and what is more culturally acceptable in our country.
So, my next question is to you, Dr. Avinash, that how can academic institutions, NGOs, and clinicians collaborate more effectively to build a sustainable mental health ecosystem post-crisis?
Well, I think in an academic institution, everyone needs to be sensitized to the mental health needs of students. So we start with principals, management, staff, students themselves all need to be sensitized that our institute is mental health friendly, and that we are open to anybody who has mental health problems and help them. Every academic institute, schools, colleges, degree colleges, universities, management institutes should have a full time counselor available. In fact, every institute would need more than one full time counselor. So they would need two or three full time counselors at least in the institute who would help, and preferably one male and one female. Though, of course, I mean, I would say that there are far larger lady counselors than male counselors, but that's okay. And I think they should also have the openness of having psychiatrists who are ready to visit them, and probably charge a very nominal fee or even pay the psychiatrist for visit. And or for that matter, I mean, there are many psychiatrists who would be ready to offer their services. The whole aim is that the stigma model gets broken when the psychiatrist visits the school or visits the college or visits the university, rather than the university telling the student that you need psychiatric help, go to the clinic. So the person thinks I've been referred to someone who's a psychiatrist because I'm mentally ill. They need to know that the psychiatrist going to the masses is what works. The fact that I visit the college means there's no fear of a clinic. They are seeing me in their educational institution. I'm seeing them there. I'm treating them there. If they wish to see me personally, that's their personal call. But the first point of contact is within their institute. So it's in the safe haven that they are already in. There's no worry. And I think parents and the students also feel secure if the psychiatrist sees them in the institute, because they think the institute endorses it and you're there to sort of help them rather than cause a problem. So that is one aspect. And I think one program which we run very successfully uh, something similar to what Dr. Rastogi mentioned about QPR. There's a QPR training called gatekeeper training to detect suicide uh, cases. We also have elevated that to just detect somebody with a mental health problem. And we say that everybody should receive training, that if someone comes to you and says, I'm anxious, I'm worried, I'm sad, I'm upset, how are they supposed to react? That's the first thing. And what is the advice they should give? But most importantly, what is the advice they should not give? That is something which is very important. And one thing that students have to know, because they're all digital natives, as I call them, they are online. Please seek help online. Visit websites, visit blogs, watch a number of reels, but make sure that the content and the matter being posted there is being done by someone like the doctors here, like Varsha Madam here, someone who is qualified. It is not just being done by anybody who posts anything. Like I remember few days back, I came across a reel that if you're not getting sleep, you put two bay leaves and two cloves under your pillow and you will get sleep. And I don't think that is advice that they should follow. They should follow scientific advice, or they should say that turn your head in the northeast direction and you will get sleep. No, I don't think geomagnetic forces will help us get sleep. So these are things which we have to train them, and academic institutions can help to train individuals in this area.
Correct, and I believe WhatsApp institutions should be stopped because they are where all these myths have started from. And to be very frank, half of us are looking forward to it. I mean, half of India is uh, completely based on that. So definitely, that these institutions have to be monitored. So my next question is to you, Ms. Varsha, that since we are almost towards the end of the session, so as a closing thought, how can we empower individuals and communities to prioritize mental health as an integrated part of the overall mental well-being?
Well, we need to start talking about it to begin with. Like we've all been saying, it's we have to really work towards reducing the stigma around mental health. And as ironic as it is, actually, the pandemic, I think, has done our profession a lot of good, while there has been undoubtedly a lot of devastation and a lot of trauma that the COVID has caused. But at the same time, I think it has given a lot of weightage and credit to the field of mental health, and the focus and the acceptance of us experiencing any sort of mental health concern. So, like I remember, anxiety and depression were some things that many people were experiencing, along with grief, as I of course mentioned earlier. But anxiety and depression was something that very prevalent during COVID, and I don't know whether it was social isolation or the fact that we couldn't distract ourselves as a lot of other WhatsApp institution posts say. Just distract yourself, do something else. And while it temporarily works, I'm not denying that, but that's definitely not the way to go. It'll give you relief for maybe 15 minutes, 1 hour, one day. So I mean, it helped in, well, like I was saying, COVID helped in giving the due respect to our field. And many people, and across the globe, in fact, people have got in touch, and online therapy has really picked up, because it started with, of course, social distancing, so we had to connect only through online forums. But now I think there's a large sense of comfort in people doing that, and it's also far more convenient. Even if you're in the same city, I have people saying that, okay, let's do it online because the traffic and where you are and where we are, it's so far, it gets tough to reach. It has really helped connect in connectivity. Uh, but however, of course, the flip side is that sometimes we get too involved and take everything that is given, that we see on, say, Insta Reels or on WhatsApp forwards a bit too seriously, and we're overly involved in it as well. So while there are, of course, advantages of this IT boom and all these forums, in fact, we all are connecting and having this talk thanks to these platforms here. But I think it's also very important to kind of look up sometimes and look at the people around you, look at your surroundings, and build those relationships that I think somewhere have been lost. Ironically, I feel that during COVID, when we were experiencing social distancing and we could not meet each other, is when the human connection was actually booming. I think we were missing that. And to understand that that is something which is our basic human emotional need. We need to connect with people in person. We need to talk, we need to do things together, not only in isolation. So I think that human connection is something that we really need to get back, and kind of be out there, and also, extending that to being kind and empathetic towards people. But somewhere that tends to get lost in the rut of life. We have to go from point A to B to C, and there are so many things to be done. Your household chores, your professional commitments, everything. That I think somewhere we get so lost in going from one point to the other that we forget to kind of say smile even sometimes, and we forget to even say like a hello or a good morning, or a simple thing like a thank you. Somebody is just holding the door for me, or somebody has held the lift and I'm like, oh wait, I'm just coming. It's I think that that's something we really need to get back to, building those connections, having shared common interests, moving out, building your own safety trusting circle, and having that sort of a support system is also something which is very basic and essential for human survival. And as the last thing that I would really like to say, which is about practicing self-care. So it's I cannot lay enough emphasis on it, and how the importance of it, but how we often tend to neglect it in times of from doing one thing to the other. It's so important to give yourself those 15 minutes or 10 minutes in a day, even if it's just sitting and sipping your cup of chai, coffee, and staring into space for nothing, but just having that little bit of time for yourself is so critical for not only your own mental health but also for the people around you. Because the healthier we are, the more healthy and positivity can be also give to the community at large. So I think it's very. I would encourage each and every person here, whoever's listening to us, to please do something for yourself, even if you can't take out long hours. At least do those 10-15 minutes of just simply staying with yourself, doing some breathing, or just having your chai in peace and telling everybody in the house not to disturb you at that time. That's my time, as we call it. And even doing other activities like whether you like art or you like sports or theater or fitness. I mean, I would also encourage everybody to do some physical activity, or a sport, or just go for a walk. But movement and kind of being able to move yourself from one point to the other, and just stretching yourself is very helpful in your own de-stressing and calming yourself down there. So, as a last note, I just want to say that yeah, self care is something very important, and self care is not selfishness. Self care is essential. Self care is important, and I hope we can all do that for ourselves every single day.
So I think that is a very positive note of ending this session, and I would like to thank each one of you for taking out a good amount of time from your busy schedule and giving it to this very important topic that needs to be addressed. And I believe forums like ours will help the society take that step forward towards addressing mental health in emergencies as well as in our day-to-day life as well, and not going and believing in the WhatsApp forwards that we get that it is just another day and it will pass. So then let us all take an oath of working towards addressing mental health in our own simple ways, and addressing this catastrophic event that might arise because of mental health issues. So thank you so much to all of you for joining. Thank you. It was a great session, and it was great talking to each one of you.
Thank
Thank
you.
you.
Thank you so much for having us over.
Thank you. Thank you.
Thank you.